Good day, everyone. Today I'll be discussing liquid dosage forms. I'll focus on the most important parts, especially those that often come out in the board exam. When we say liquid dosage form, these are preparations that contain one or more active ingredients dissolved or dispersed in a liquid medium, usually for oral, topical, or parenteral use. Liquid dosage forms are very important because they are easier to swallow and are often used for children and elderly patients who have difficulty taking tablets or capsule. Now let's go through the main types under this category. So first we have the solvents. When we talked about solvents, these are the liquid vehicles or mediums that dissolve the active ingredient or the drug. Think of the solvent as the base of the liquid preparation. In simple terms, kung asa nato gidissolve ang tambal, mao na siya ang solvent. Common examples of solvents include water, the most common and safest solvent, especially for oral preparations. We also have alcohol, often used to dissolve drugs that are not suitable in water, and then glycerin, used for its sweet taste and viscosity. We also have propylene glycol, used also used as a co-solvent. So the choice of solvent depends on the drug solubility, stability, and route of administration. So let's say for example, if the drug is for oral use, we usually prepare aqueous solvents like water, but for topical or injectable use, sometimes non-aqueous solvents are needed. Okay, next we also have the solutions. A solution is a homogeneous liquid preparation, meaning the drug is completely dissolved in the solvent. There are no particles visible. Everything looks clear and uniform. Kung i-compare nato, solution is like sugar dissolved in water. Dili na nimo makitan ang sugar pero naa siya sa liquid. And then next, under solution, we have the aqueous solutions. These are solutions that use water as the solvent. Again, these are the solutions that use water as the solvent. They are the most common type because water is safe, cheap, and compatible with many drugs. Example include oral solutions like paracetamol oral solution. We also have syrups, the sweetened aqueous solutions, and the mouthwashes, the antiseptic aqueous solutions. So aqueous solutions are prone to microbial growth, so we usually add preservatives like parabens or benzoic acid to prevent spoilage. And then second, under solutions, we have the non-aqueous solutions. These are solutions that use solvents other than water. They are used when the drug is not suitable or not soluble in water. Common non-aqueous solvents include alcohol, glycerin, and oils like olive oil or mineral oil. For let's say for example, elixirs, a hydroalcoholic solution, a mixture of water and alcohol. We also have tinctures, alcoholic or hydroalcoholic extracts of plant or animal materials. And then the liniments, the oily or alcoholic solutions for external application. Now, remember that non-aqueous solutions can improve solubility and stability, but we must consider patient safety and taste for oral use. Okay, now let's have the solvents for liquid preparations. So when we talked about solvents, remember that these are the liquid vehicles used to dissolve or carry the active ingredients in liquid dosage forms. Among all the solvents, water is the most common because it is safe, cheap, and physiologically compatible with the body. Now let's go through the different types of pharmaceutical water used as solvents and their specific purposes. Now first, let's have the purified water USP. This is highly purified water used in most liquid dosage forms except for parenteral or the injectables and the ophthalmic or for eye products. Why? Because those types of products require sterile water, not just purified water. And then let's go over the methods of purification. So purified water can be obtained by several processes like first, distillation. This process involves boiling water to produce vapor and then condensing it back to liquid form. It removes impurities, microorganisms, and most dissolved solids. Mao ni ang pinaka-simple o pinaka-klaro nga process sa purification. Second, we have the ion exchange. This uses resins to remove unwanted ions like calcium, magnesium chloride that make water hard. It produces water that is chemically pure, free from charged particles. And then third, the reverse osmosis. So water is forced through a semipermeable membrane that filters out impurities and microorganisms. This is the most efficient and commonly used method today in pharmaceutical industries. So the uses of purified water USP is used as solvent or vehicle in oral preparation, again syrups, oral solutions, topical preparations like lotions, mouthwash, and external use preparation. Now let's move on to water for injection USP or the WFI. Now this one is used mainly for parenteral products, meaning products that are injected into the body, like IV fluids or injectable drugs. It is the most commonly used solvent in the large-scale manufacture or parenteral preparations. Important characteristics: it must be pyrogen-free. Pyrogens are fever-causing substances, often from bacteria. To make it pyrogen-free, water for injection is obtained from purified water that undergoes depyrogenation. Again, it is obtained from purified water that undergoes depyrogenation. And then remember, water for injection is not yet sterile, but must be pyrogen free. It's used in manufacturing where sterilization happens later in the process. And then third, the sterile water for injection USP. This one comes from water for injection that has undergone sterilization. Again, this one comes from water for injection that has gone sterilization. So kung ang water for injection kay sterilize, mao ni siya ang gitawag nga sterile water for injection. Key uses: it is used for reconstitution of multiple antibiotics and other sterile powders before administration. It is packaged in single-dose containers not exceeding 1 liter. So remember, sterile water for injection are the water for injection that has been sterilized and packaged for single use, commonly used to dissolve or dilute injectable drugs before administration. Okay, let's summarize the three examples. So first, the purified water USP. Then purification or characteristics. It is purified through distillation, ion exchange, and reverse osmosis, and then used for oral, topical, and external products, and then not for parenteral and ophthalmic use. And then second, the water for injection USP. It is pyrogen free, and then depyrogenated siya, and then used for large-scale manufacture of parenterals, and then not for ophthalmic or non-sterile use. And then third, the sterile water for injection USP. So it is water for injection that has been sterilized. The single dose na siya, lesser than 1 liter. So it is used for reconstitution of antibiotics and injectables, and not for multi-use containers. Okay, next, the bacteriostatic water for injection USP. This is basically sterile water for injection, but with added antimicrobial agents. That's why it's called bacteriostatic. The antimicrobial agent help inhibit the growth of bacteria, so the solution can be used multiple times or multi-dose vials. So its uses, it's commonly used as diluent for medications that need reconstitution before injection, packaged in pre-filled syringes or vials not more than 30 ml in volume. Then important caution, not recommended for neonates or mga newborns because it contains benzyl alcohol, since this preservative can be toxic to them. And then Kung sterile water for injection kay single-use, kani nga bacteriostatic water for injection kay for multi-use siya, tungod kay naa siya'y preservative. Pero dili siya pwede sa mga newborns because of benzyl alcohol. Benzyl alcohol serves as the preservative. And then next, the sterile water for inhalation (USP). This one is a purified water that has been sterilized and is used as a vehicle for inhalation solutions like for nebulizers. So it's used as a diluent or vehicle for drugs that will be inhaled through a nebulizer or inhalation device. The instrument used should be capable of producing fine particles para ma-inhale properly a medicine into the lungs. So kung mag-prepare ta og inhalation therapy like sa asthma, we use sterile water for inhalation as the solvent or vehicle. This helps create the mist that the patient inhales through the nebulizer. And then next, the sterile water for irrigation (USP). This is also purified and sterilized water, but it is specifically made for irrigation or washing purposes, not for injection. It is used for irrigation, washing, rinsing, and dilution during medical or surgical procedures. It's safe for external or cavity use but not safe to inject into the body. So label requirement, it must clearly say for irrigation use only and not for injection. So kung naa mo makit-an nga bottle nga sterile water for irrigation, always remember dili na siya for injectables. It's only for washing, rinsing, or irrigation sa surgical areas. Okay, summary for the three: bacteriostatic water for injection (USP). It is used for multi-dose and not for neonates, kay naa siya'y benzyl alcohol. Okay? It can cause benzyl alcohol toxicity for neonates. And the description or use: sterile water for injection plus antimicrobial agent si bacteriostatic water for injection. And then, sterile water for inhalation (USP). Description: it is vehicle for inhalation therapy via nebulizer. And then, it produces fine particles for inhalation. And then third one, the sterile water for irrigation (USP). It is for irrigation, washing, rinsing, and dilution. And dapat na siya label nga for irrigation use only and not for injection. Okay, under liquid dosage forms, aqueous solutions are those that use the water as the solvent. One important example of an aqueous solution is aromatic water. Aromatic waters are clear, saturated aqueous solutions of volatile oils or other aromatic or volatile substances. In short, these are flavored or scented waters that contain a small amount of essential or aromatic oil dissolved in water. Example: peppermint water, rose water, camphor water, and it is used as flavoring agents, therapeutic vehicles, or perfumed preparation. And then, one problem, kay mo salting out siya. Okay, one common problem in aromatic waters is salting out. This happens when salts like sodium chloride or potassium chloride are added into the solution, which causes the volatile oil to separate from the water, making the liquid cloudy or turbid. In simple terms, when salt is added, the oil gets pushed out of the water. Maunang murag nag-separate ang oil og water. So aromatic waters should not be mixed with salty solutions. And then there are three main methods to prepare aromatic waters. First, distillation or cohobation method. The volatile substance is distilled with water and the distillate is collected. If some oil separates, ibalik siya sa distillation flask. This is called cohobation. It produces clear and stable aromatic water, and it is the best method for high quality products. And then second, the solution method. The simplest method. Shake the volatile oil with purified water and then let the excess oil separate. Then filter the clear liquid. It is used when the oil is readily soluble and stable. And then third one, the alternate solution method, used when the oil is not very soluble in water. The oil is first mixed with a solubilizing agent like talc or alcohol before adding water. Then the mixture is filtered to get a clear solution. Okay, next example, next dosage form of aqueous solution, we have the diluted acids. Diluted acids are aqueous solutions of acids prepared at a suitable strength, usually 10% weight over volume, which means 10 grams of acid in every 100 ml of solution. So basically, the concentrated acid is diluted with purified water to achieve a weaker and a safer concentration that can be used for pharmaceutical or medicinal purposes. So kung concentrated acid like hydrochloric acid or acetic acid is too strong, we dilute it with water to make it safer to handle and use. These diluted forms are what we call diluted acids. So common examples, let's say diluted hydrochloric acid NF, concentration 10% weight over volume, used as an acidifying agent and gastric stimulant. Again, used as an acidifying agent and gastric stimulant. Next, diluted acetic acid NF, so concentration 10% weight over volume, used as a mild antiseptic or germicide. And then the third one, diluted nitric acid NF, concentration 10% weight over volume, occasionally used for pharmaceutical preparation. Preparation method. So we usually prepared by carefully adding the concentrated acid to purified water, not the other way around. This prevents splattering or overheating, which can happen if water is poured into acid. So again, add acid to water. Never add water to acid. Then precautions, always use purified water to prevent impurities. Store in a well-closed glass containers because acids can react with metals. And then label properly with diluted to avoid confusion with concentrated acids. Okay, remember that diluted acids are just weaker forms of strong acids used in medicine, usually at 10% weight over volume, made by adding acid to water and mainly used as acidifying agents or antiseptics. Next dosage form, the juice. So juices are aqueous solutions prepared from fresh, ripe fruits. They are mainly used in making syrups that serve as flavoring vehicles for oral preparation. So kaning nga type of aqueous solution kay gikan sa natural fruit juices, usually ginagamit siya to add flavor or therapeutic value sa mga syrups or other preparations. Like let's say for example cranberry juice. It is used for treatment or prevention of urinary tract infections or UTI and urolithiasis or the kidney stones because cranberry helps make the urine more acidic, preventing bacterial growth and stone formation. So tip to remember, think of cranberry juice not just a drink but also a medicinal juice used in pharmacy for UTI prevention. Okay, important notes must be prepared from fresh, ripe fruits only, should be strained and clarified to remove solid particles, and then because they are perishable, they are often preserved with alcohol or sugar or used immediately to make syrups. Next, we have the gargle. So gargles are aqueous solutions used to treat or cleanse the throat and mouth, specifically the pharynx and the nasopharynx. They are applied by forcing air from the lungs through the throat while holding the solution in the mouth. That's the act of gargling. So when you gargle with a solution, you're actually treating the back of your throat. The air from your lungs helps the liquid reach deeper areas, maunang effective siya for sore throat or mouth infections. And its uses, it relieves soreness or irritation in the throat, reduce inflammation, act as an antiseptic or disinfectant. Like, let's say for example, povidone iodine gargle or the salt water gargle. Okay, Always remember it should not be swallowed, okay? Only for rinsing or gargling. Some are ready to use while others are diluted with warm water before use. Now, the mouthwashes. So I know you're very familiar with this. Mouthwashes are aqueous solutions used to clean, deodorize, and refresh the oral cavity. They are applied by swishing the liquid around the mouth for a short time, usually 30 seconds to 1 minute, and then spitting it out. So mouthwashes are liquid preparations we use to rinse the mouth, not for swallowing, but for cleaning and oral care. Types of mouthwashes. First, we have the cosmetic mouthwashes. It is used mainly to refresh the mouth, remove bad odor, and improve taste. Example, commercial mouthwashes like Listerine or Colgate Plaques. They help in oral hygiene, but they don't treat diseases directly. And then second, therapeutic mouthwashes contain active ingredients that have antimicrobial, anti-inflammatory, or antifungal effects. It is used for oral infections, gingivitis, or post-dental procedures. Like, let's say for example, chlorhexidine gluconate mouthwash. It is used to reduce bacteria in the mouth. And then additional type, the diagnostic mouthwash. Some mouth rinses are used for diagnostic purposes, like for example, toluidine, the blue mouth rinse. Again, toluidine blue mouth rinse. It is used to detect oral cancer or precancerous lesions by staining abnormal tissues blue. Okay, so aside from cosmetic and therapeutic, naapod tayo diagnostic type like toluidine blue rinse na makatabang ma-detect ang oral lesions or early cancer signs. Okay, important note to remember, mouthwashes are not swallowed, always spit out after use. Some may contain alcohol, flavoring, or antiseptic agents, and they should be pleasant tasting and non-irritating to the oral mucosa. Okay, so mouthwashes are aqueous solutions used for oral care. They can be cosmetic, pang-refresh, and then therapeutic, pang-treat, or even diagnostic, pang-detect oral lesions. And then always remember, swish, don't swallow. Now let's talk about douche. So a douche is an aqueous solution that is directed against a part or into a cavity of the body for cleansing, antiseptic, or therapeutic purposes. So kung moingon tag douche, pasabot anak kay solution nga ginagamit para hugasan or limpyuhan ang certain body cavity, for example, vaginal, nasal, or rectal area. The liquid is applied under gentle pressure using a special device or container to allow it to flow over or into the area to be cleaned. Types of douche, depending on the area of the body where it is used. We have several types, like first nasal douche, used to clean or irrigate the nasal passages. Example, normal saline nasal wash. Again, normal saline nasal wash helps relieve nasal congestion or remove mucus. And then we also have ophthalmic douche. It is used to wash or irrigate the eyes. It must be sterile and isotonic to prevent irritation. Okay, I wash solution like boric acid solution. Okay, board exam question na siya. I wash solution, again, boric acid solution. And then third, vaginal douche, used for cleansing or treating infections in the vaginal cavity. Should be mild and non-irritating. And then for example, acetic acid or antiseptic vaginal douche. And then fourth, the rectal douche, used to cleanse the rectum before medical procedures or to relieve constipation. For example, warm saline enema solution. Okay, important notes. Douches should be prepared freshly before use. Must be free from solid particles that could irritate tissues. And then temperature should be close to body temperature, around 37 degrees Celsius for comfort. And then devices used must be clean and sterile to avoid infection. Okay, another important aqueous solution, the enema. An enema is a solution administered rectally either for local effects like cleansing the bowel or for systemic absorption when the drug is absorbed through a rectal mucosa. Kung moingon tag enema, mao ni ang solution nga gi-administer sa rectum gamit ang special nozzle or syringe. Pwede siya para pahugaw or the evacuation or pamaayo sa sakit or the retention. The rectal route is often used when the patient cannot take medicines orally or a local action like bowel cleansing is desired. Okay, and then types of enema, evacuation, enema. So purpose to cleanse or empty the bowel by stimulating peristalsis and softening fecal matter. And then volume 1 to 2 pints, approximately 500 to 1000 ml. And then action, it acts locally. Okay, example, sodium phosphate enema, like fleet enema, then commonly used before diagnostic procedures like colonoscopy or surgery. And then second, retention enema. So yung purpose, the solution is retained in the rectum for absorption or local treatment. So volume less than 150 ml. Okay, its action can be systemic or absorbed into the blood or local. Kanang anti-inflammatory lang siya. And then examples like aminophylline enema for bronchial asthma, systemic na siya, okay? Systemic na enema for bronchial asthma. And then hydrocortisone enema for inflammatory bowel disease. Mo na siya example sa local nga enema. Okay, again, retention means dili dayon siya ipagawas. So ang solution, i-retain sa rectum aron maabsorb ang tambal. Okay, important notes to remember. Enema solutions must be clean and sterile. The temperature should be around body temperature 37 degrees Celsius to avoid cramping. And then the rectal tube or nozzle must be lubricated before insertion. And the patient should lie on the left side, like seams position, during administration.